Hi, I'm Jenny Marwitz, Associate Professor in Department of Physical Medicine and Rehabilitation at Virginia Commonwealth University. Today I'd like to talk about pulling all the pieces together for your study, your grant application, some of the other pieces that are involved in writing a successful grant application. In addition to your background, the importance of the problem in your research design, you'll also want to talk about your plan of operation, your how you collaborate with others, project staff, the adequacy of your resources, and a plan of evaluation for your proposal. While points are often lost in the project design, just because reviewers may not fully appreciate your ideas or your project, these other sections are a place where you should be able to get most of your points. If you clearly write to the selection criteria and have some good ideas on how to present your strengths. I'd first like to talk a little bit about the plan of operation. For the plan of operation, it's also called the management plan. This is where you'll be talking about the adequacy of your plans to achieve the objectives of the proposed project on time and within budget, including clearly defined responsibilities and timelines for accomplishing those project tasks. This, what I just said is an example of a specific selection criteria, so something that reviewers might be looking at as they review your grant application. I like to start off the plan of operation with a description of our principles, your principles of how you focus on managing your projects. So giving a clear designation of responsibilities, authority lines, timelines, and a coordinated use of your resources to stay within budget. These are some topics that you might want to cover as you talk about your philosophy or the cornerstones of your plan of operation. You'll want to give an overview of the organizational entities included in your plan. You'll want to include an organizational chart, and you'll also want to give a description of the roles of each person you're proposing to have on your grant. Some organizational entities that you might include are your funding agency, and a description of how you'll work with them in managing your project. You may also be interested in having a senior management team. This could be personnel from the principal investigator, co-PI, project coordinator, and others who will take the primary responsibility for management and quality monitoring of both your research and hopefully some dissemination activities. The senior management team would be the group that assure that the objectives are accomplished within time frames, within budget, and are cost effective. Other entities that you would describe in the plan of operation could include your research project directors, any project associates, an advisory board, any advisors or consultants. You may also want to include a project evaluator, someone from outside of your grant who will be an objective individual to review how you are doing in accomplishing the tasks that you set out to do. A description in this section would include a description of the responsibilities of each person that you are proposing to fund. So you'll want to describe your principal investigator in detail and what their administrative duties are. So some might be maintaining adherence to federal and state regulations, monitoring budgetary expenditures, coordinating the research program development, monitoring all program activities to ensure progress toward stated objectives. Will you have a co-PI? If you do, their description would be similar to the principal investigators, talking about how they will assist the PI in managing the program. So this is where you really talk about the administrative duties. And you'll also want to, as I mentioned, you'll want to have a brief description of each other person that's funded in your proposal and what their responsibilities are as well. Don't forget mentioning the grant administrator and how they'll take responsibility for purchase orders, organizing, maintaining financial records, coordination of equipment purchases, if that's appropriate, and all review of all expenditures. So talking about your fiscal administration is part of this section of the grant. As I mentioned, a senior management team may be something that you want to include, depends on the size of your proposal, and an organizational chart. Your organizational chart should have to the sides your advising bodies, whether that's a group of scientific advisors, an advisory board, a program evaluator, so those that offer independent oversight of the project. In addition, your organizational chart will include the fiscal administrator, project coordinator, and also research associates or any other staff that will be helping to complete the grant's activities. I'd like to take a moment to talk about advisory boards. It's a good idea to include an advisory board. It may not be a large group of people. It could be a group of 6 to maybe as many as 14 or more. But having them play a role in your project implementation, making sure that the program stays relevant, innovative, and of high quality. Also, you'll want to try and bring a multicultural perspective, to have a diverse group who may be composed of individuals with the illness or disorder that you may be working with, or their family members, as well as people with advanced degrees who have an expertise in the area that you're researching. You'll want to propose how often the advisory board will meet with your senior management team or with your top grant staff. Will be maybe 2 years in the first year of the funding, and then once a year after that, maybe more frequently, depending on your needs. Meetings should be a time that you'll be able to solicit input from your board members, review your progress, and get input from them on planning future activities. Nice to update your advisory board at least quarterly on all activities that you've been doing. So this is an important piece to include in your application, typically for a larger funding application. I also like to include a table listing advisory board members' qualifications and their expertise. How their expertise relates to what you are looking at or working on in your grant. So for example, I have had a large grant looking at traumatic brain injury funded by National Institute on Disability and Rehabilitation Research, the Traumatic Brain Injury TBI Model System. Our advisory board consists of 10 individuals. We have the chair of the Brain Injury Association of Virginia, so our state chapter. We also have individuals from other state agencies such as Disability and Rehab Services and our Vocational Rehab Services Agency, individuals in other hospitals or community service programs related to brain injury. We also have a couple physicians on the board, as well as a couple survivors and a couple family members. So that rounds out the board, and we do meet twice a year the first year and once a year after that. Also in your plan of operation, you may want to consider a group of scientific advisors. So your advisory board may come more to the relevance and making it relevant to your stakeholders, while the scientific advisors could be a group to talk with you more about design, methodology, data analysis, and interpretation. It's a nice thing to include if there are people in your institution or agency that could serve in that capacity. Scientific advisors are, at least for us, typically come from within our agency or our university. Finally, I mentioned a program evaluator. So someone outside of your department or program that you'll report to who serves as an objective member to look at what you've done and whether you're staying on task. Our program evaluators from another department within the university has agreed to serve at about a 5% effort level, and their main job is to keep a look on how we're doing and whether we're hitting the targets that we stated that we would initially. Lastly, for the plan of operation, you'll want to include a very specific timeline. You'll want to, the more specific you can be, the more helpful it'll be, the more believable it will be for your reviewers. They'll have a clear understanding of what is happening when, so to make the project work so that you can deliver what you are promising to deliver. In the way that we've included it in some of our applications is in table format. So, and breaking down different types of activities. So there may be what I would call program management activities, and then there are the research activities. So program management activities may include things like weekly senior management team meetings, review of progress reports from project directors or research associates on your grant, while your research activities would be focused more on training for data collection, database development, accrual and recruitment of research participants, and quality control procedures, those kinds of things. And in the first year of your grant, you may want to have the timeline only implemented in 2-month intervals. And then after that, you can stretch it out a little as you are not doing as many startup activities and you're just managing the accrual of patients, having your regular meetings, implementing your quality control procedures, reviewing progress with your advisory board. I also want to mention quickly that the plan of operation is also where your administrative and fiscal management procedures will be described. This also will, in this section, you can also talk about your relationship with others in your agency. If there are other offices for grants and contracts or sponsored programs, you can talk about those entities in this section of your grant application. Next section that I'd like to talk about is a section that is often included in the selection criteria, and that is on collaboration. It may also be called expertise, previous collaboration. So this section of your application, if it's included within the selection criteria, focuses on the extent to which the applicant's proposed collaboration with one or more agencies, organizations, or institutions is likely to be effective in achieving the relevant proposed activities of the project. So that may be one selection criteria. It's an example. Another one might be the extent to which agencies, organizations, or institutions demonstrate a commitment to collaborate with the applicant. So you've really got two different pieces to this section. The extent to which your proposed activities involve collaboration with other agencies, and the extent to which those agencies are willing to collaborate with you. Topics you might cover in this section would be, again, as I mentioned in the plan of operation, a general overview of your principles of collaboration. So what's important in having good collaboration? Some examples might be close communication, shared interests in the project, a focus on solutions, and mutual respect and support. Following a little description of your philosophy or your principles, you could list a group of entities or collaborators within and outside your university, agency, or institution. So some examples of groups outside of the agency would be advocacy organizations, maybe community-based rehab centers or facilities outside of your institution. Other services provided by state agencies, and like I said, advocacy organizations at both the local and national level, and any other groups that might be involved in your project, VAs, EMS, those types of groups as well. In addition to talking about your collaboration with groups outside of your institution, you'll want to talk about your collaborations within your agency. So other departments that you work with, other services that you work with, on campus, off campus, groups that are part of your institution. In addition, if you can give some examples of successful collaboration from your past, that will show reviewers that you have a history of good collaboration. So any projects that you've worked on with other groups, whether it's has been organizing conferences or speaking at conferences, working to develop new services for individuals with disabilities, other grant funding that you've had where you've worked with other agencies. So, for example, in one of our recent studies, we were able to talk about how long we had worked with other funded institutions or universities. If we had publications with individuals from outside of our university, what those publications looked like and how they were successful in disseminating information related to the topic at hand. You'll want to take a look at other funded entities that you could build collaborations with. So if your funding agency has funded other groups that are maybe located nearby, reaching out to them, coming up with some ways to work together will show that you've got some great experience in collaborating. Also within this section is where you'll want to refer your reviewers to any letters of support that you've received from collaborators. Letters are particularly helpful when you receive a commitment to collaborate on the proposed application. These show the reviewers that you're taking not only the resources that that you're proposing that they provide, but you're extending them to others that will help in fulfilling the project's activities. Moving on to the next section. Your project staff section is an important place where you'll talk about your key personnel, their percent effort, their training and experience. You'll also talk about how you hire and recruit new staff, and assure your reviewers that you have an adequate commitment of time by your proposed staff to accomplish the activities within the grant. So if you can state that your agency encourages application for employment from persons who are members of groups that have traditionally been underrepresented based on age, color, national origin, gender, age, or disability, that will help in showing that you're an equal opportunity employer. If your institution includes any policies, procedures, you might want to highlight those or even include those in an appendix. In talking about recruitment, showing that you work well with other organizations to recruit a diverse staff, including individuals with disability, will be important. If you can talk about any agencies that you reach out to when you're trying to fill a position. If you can also talk about people that you've successfully recruited in the past that come from diverse backgrounds. While it may seem a little uncomfortable to highlight our differences, this is a place where you can show reviewers that you are indeed focused on diversity. So you could, for example, say, of the 16 staff we currently have, X number are from a minority background. Of those staff, X number have a documented disability. This is showing the reviewer that you have recruited in the past to have a diverse staff. That's very important. In addition, you'll want to take this time to describe the abilities and experience of each of the staff that you have. Often space can be an issue when you're preparing a proposal, but putting in a biographical sketch, a paragraph typically describing the education, career, and experience of your proposed staff members is important here. Also, anything in particular regarding their specific interests or expertise in the topic of the proposal. So, for example, I have a number of different biographical sketches based on the focus of the grant I'm writing. If I'm working on a grant application to look at families after injury, then I'll be highlighting my work in my past that I've done with families. On the other hand, if I'm looking at depression following neurologic disorder, I'll be highlighting my work in psychological evaluation or psychological measurement. So you'll want to fine-tune each paragraph on each staff to make it seem most relevant to the project that you're proposing. This is also a place where you can highlight the percent effort of each person that's proposed in your study. And it is, we found it helpful to include a table with percent effort included. So your principal investigator, what percent effort will they be spending on administration and dissemination activities? What percent effort will they be spending on various research activities? And if you have more than one research project, break it out by those projects to show reviewers that you've thought about what it's going to take from each staff member to make sure that each project is completed successfully. In addition to the paragraphs on all of your proposed staff, you may also want to include a description of other individuals within your agency or institution that may have a role on the grant. These are people who may not be paid off of the grant, but would also have a role in helping ensure that the project is completed successfully. So for example, we might include in there members of the interdisciplinary rehab team who may help in recruiting individuals for some of our projects, nursing staff, physicians in other clinics. These are people that have a role in the grant, although they are not actually funded off of it. If you have a number of people in positions like that, you might want to include an appendix with a little description of each of them. Having a variety of appendices in your project helps to back up some of the statements that you've made within the proposal. In addition, appendices are typically not included in your page count, so it's a way to add more information to your grant without running out of space. The next section that I'd like to discuss is a section called adequacy of and accessibility of resources, sometimes called organizational resources and commitment as a selection criteria. What reviewers may be looking for in this section of your grant application is the quality of an applicant's past performance in carrying out a grant, the extent to which the applicant has appropriate access to clinical populations and organizations to support the research, and the extent to which facilities, equipment, and other resources are appropriately accessible to individuals with disabilities. If you are from a large institution, you may find that you could write for pages and pages and pages about the adequacy of your resources. This is where you can really brag on the accomplishments of your entire agency, university, or institution. So, for example, here at Virginia Commonwealth University, I might start this section off in very broad terms. VCU is an accredited Division I university with 12 major schools, including the School of Medicine, which manages a medical center. Then going on to talk about the amount of dollars a year in sponsored research are received by the university, how there's impressive infrastructure to support research, a little history about your institution, operating since what year, a leading center in what areas, anything special in particular. For example, we're the region's only level 1 trauma center, so we can talk about our catchment area, what individuals will be seeing and providing services to. Also talk about how many people you serve per year, how many admissions to your hospital, if those are the kinds of services you provide, how many outpatient clinic visits are there, Do you provide care for the indigent? What does that care look like? Do uninsured individuals get treatment from your institution? How do you serve people who can't pay for the services? That could be a general introduction to your adequacy of resources. From there, you'll want to take time to describe your department, maybe your division, and also talk about relationships within other departments. So interdepartmental relationships. For us, talking about our relationships with the Department of Neurosurgery, with the Department of Psychiatry, and the Department of Biostatistics. Those are the things we want to highlight. Next, we would, after giving an overview of your institution or agency, you'll want to talk a little bit about your past grant performance. It can get a little tricky in this area because if you talk too much about how well you've done in the past, reviewers may start to wonder why you need additional funding. So having that balancing act between what makes you great, how much you've accomplished, but still outlining that there's more work to be done and why you need the grant funding to do it. It's an important line to walk. So you may want to include a data report from previous work that you've done. Include that as an appendix, most likely. Any other appendices that can show what work you've done in the past, maybe an appendix of past publications in journals, or an appendix of past presentations at conferences, shows that you've gotten the word out about the work you've done previously. If you haven't had a lot of experience in managing grants or getting grant funding, maybe you can talk about the experience of others in your department or within your agency who've had success with grant funding and have done some things with that. Beyond your past grant performance, your overall strength of your agency, you'll want to talk to your access to the people that you're trying to serve. So for us, talking about our access to clinical populations is important. How will we recruit individuals for our research or for our program development activities? Well, what are our connections with within and outside our agency to recruit and retain individuals with disabilities that you're interested in providing services for or doing research with? I like to include some tables showing the kinds of numbers of people with specific needs that have been served in the past by either our clinic or another outpatient service, or who've been admitted to our hospital for services. Finally, you'll want to include a description of your continuum of care, if appropriate. So what clinical services do you provide within and outside your institution? What makes you a strong candidate to not only recruit individuals for research, but also meet their needs if there are any clinical needs? Another section of this part of the selection criteria is on the accessibility of the resources. So we've talked about the adequacy of the resources. Now I want to talk a little bit about the accessibility. So I'm talking about compliance with American with Disabilities Act, as well as Sections 503 and 504 of the Rehab Act of 1973 will be important to mention here. Does your entity or university, do they have an ADA coordinator? Do they have an office or department for EEO, AA services? Who develops and administers policies, procedures, and practices to assure compliance with laws and other state and local regulations regarding physical access, non-discriminatory practices for persons with disabilities? Highlighting your ability to keep your resources accessible to all is an important piece to include here. Does your agency have any committees that works to ensure access? For example, we have a University Access Committee that includes representatives from administration, resources, students, faculty, facilities management, etc., to make sure that we are indeed providing an accessible location for students, patients, and anyone who may have a disability. Another thing that I like to include here is another appendix where you might, within that appendix, list any policies and procedures that your agency has. So that's not only, that's just pointing the reader to a place where they can read further about how you're implementing ADA. Finally, anyone within your agency get any grants to address the implementation of ADA? Anyone in your agency focus specifically on accessibility? If so, this is a place where you can highlight that you've received funding to work specifically on accessibility issues. Now I'd like to talk about the plan of evaluation. Last section of these other selection criteria that you may have included in a proposal. Again, I'd like to state that writing to the selection criteria is one of the most important things you can do in preparing your best possible grant proposal. Writing to these selection criteria will assist the reviewer in easily identifying where and what you're doing to address their score sheet. The plan of evaluation is sometimes included with the plan of operation, so it may not be its own section, but specifically it's the extent to which the plan of evaluation provides for periodic assessment of a project's progress that is based on identified performance measures that are clearly related to the intended outcomes of the project and expected impacts on the target population, and are also objective and quantifiable or qualitative as appropriate. That's what I've just said is an example of a selection criteria from a recent RFP that we responded to. So, within your plan of evaluation, you'll want to cover an overview of your philosophy of program evaluation. So this is where you might want to talk about how you need clear objectives and responsibilities, that you'll develop performance measures or you've already developed performance measures, and that you have an implementation plan for the evaluation of your project. So different from the plan of operation, which is more of an administration of the project, this is evaluating the project. Sometimes it's nice to include a graph or table identifying objectives and organizational entities responsible for program evaluation. So, for example, some entities that you might include are the funding agency, how you're going to keep your funding agency appraised of your activities and how you're meeting your targets and outcomes. Another area another group you might mention would be, of course, your senior management team, how they're going to work to assess the progress of each of your activities. So, as you describe each entity and their planned activities, you'll want to highlight, maybe in bullets, the different groups that you've got involved in evaluation, in your plan of evaluation. So, as I mentioned earlier, in the plan of operation, you may want a program evaluator, someone from another department outside your group that would be an objective person to review and monitor your activities. In addition, you'll also want to talk about your advisory board members, how they'll formally review your progress, as well as any senior leadership and any other groups within or outside of your agency. It's also important to identify performance measures, or you might call them benchmarks for enrollment in your studies, data completeness, data errors, staying within budget, and your dissemination activities. So, for example, this is where you might, in setting up your benchmarks, you might monitor how many presentations are you proposing to do annually with the funding, and then looking back on that and saying, in the last quarter, how are we doing in meeting those targets? How many newsletters are you planning to put out? How many patients or research participants do you want to recruit for your study? How are you doing in meeting those benchmarks or those targets? In addition, this is a place where you can talk about the logic model. It's a very useful tool in some cases for monitoring your progress in getting the outcomes and the impacts that you hope to attain with your funding. There's pros and cons to logic models. Some can be very complex, and with the complexity become more difficult for reviewers to follow and understand. Other times a very simple model can be very powerful in showing reviewers exactly how you expect your proposal or your project to have the outcomes that you're seeking. I'll talk a little bit more about performance measures and how that relates to a logic model, or if it's just in a table format where you're highlighting some of those performance measures and then focusing on any plans to remediate problems if you're not meeting those performance measures. So some measures related to program administration might be the extent to which your expenditures are consistent with your proposed budget, the success of recruitment and retention of highly qualified, competent, and diverse applicants, the success of training staff to effectively carry out the responsibilities. Regarding research activities, some examples of performance measures might be quarterly enrollment numbers. Have you met the minimum specified for the project? Percent consent and percent follow-up rates. If you, for example, you are hoping to get at least 80% of those approach to consent to be in your study. What's an acceptable follow-up rate if you're doing a follow-up after your initial enrollment? Completeness of your data collection forms. Less than 5% missing data, and error rates of data collection and data entry. Again, hoping for setting a benchmark of less than 5%. And finally, any dissemination activities, the annual number of publications, presentations, other products that are developed as specified within your proposal. You also want to include in your plan of evaluation a timetable for when you're going to complete the performance measures. How often is your program evaluator going to look at these outcomes, look at these performance measures, and what kind of report are you anticipating that your program evaluator prepare? An implementation assessment, an impact assessment, what kinds of reports? And again, how often will you review with your advisory board members, your senior leadership, and your funding agency regarding your progress in evaluating your program? Finally, you'll want to include a problem identification and remediation section, a place where you can describe if we find that problems have arisen, how will we address those problems? What's our plan of action to fix any unforeseen problems that arise? So, talking about other groups you may pull in who will help you come up with solutions, who you'll communicate with, and in summary, talking about how your evaluation plan is going to require attentively monitoring progress, interrelating resources, and addressing concerns proactively, how your effective organizational and management strategies will be identified and promoted within all aspects of your project, and how you'll have internal and external groups that will actively participate in a systematic evaluation focused on using clearly delineated performance measures. With this information, I hope that you will have success in completing grant applications and that you will enjoy the opportunity for funding, doing great work to promote addressing the needs of individuals with disabilities. Thank you for your time.